Hello and welcome to Coffee and Conversations with eTrepid, HIPAA Compliance in the midst of the pandemic. I'm Jim Garvin. I'm the eTrepid's Chief Information Security Officer for eTrepid, here to meet your needs and help guide you on your journey to compliance. And also on the call today is Tom Blanford, the CEO of eTrepid and the mastermind behind the company. Tom has a unique career path that resulted in the establishment of a company in the image of his service. As a U.S. Navy veteran, Tom's military service and information technology background led him to create and become a premier award-winning global IT service provider. For those of you who are not familiar with eTrepid, our team focuses on the areas of cybersecurity, cloud computing, AI, and machine learning, as well as unified communication services such as voice over IP. eTrepid services are highly customizable and can be specifically developed to meet any business needs or compliance concerns. Our headquarters is located in Mechanicsville, Maryland, and we just opened an office in Noida, India, staffed with all eTrepid employees. Today's Coffee and Conversation with eTrepid brings you guest speaker Paul Redding, Vice President for Partner Engagement of Cybersecurity. Paul will be speaking to us today about what it truly takes to be HIPAA compliant, how to assess and secure remote workers environments, which has been an increasingly asked question due to the current environment caused by the pandemic, and what has changed about HIPAA because of COVID. The Q&A will be happen throughout the event, but we'll hold all questions to allow Paul to go through his presentation, and we'll answer the questions at the end. Paul will be speaking to us today what truly makes HIPAA compliance and how to assess the secure remote worker environment, which has been increasingly asked questions due to the current environment caused by the pandemic, and what has changed about HIPAA because of the COVID. Everyone who's here today and remains on until the end of the presentation will receive a $10 Starbucks gift card. We did receive your information during the event registration, and we'll be reaching out to ensure you receive your cards. For now, we're happy to host your midday pick-me-up, so let's get started. Paul Redding, he's from HIPAA Compliancy Group, Vice President and Partner Engagement of Cybersecurity. Paul joined the Compliancy Group in 2019 after nearly 15 years as owner of an IT service provider, focusing on supporting medical and manufacturing clients, eventually building a client base that spans over 25 states. Paul's team partnered closely with Compliancy Group to provide complete HIPAA compliance for their clients. And in 2019, Paul stepped down from his MSP and became the Compliancy Group new VP of Partner Engagement and Cybersecurity. Today, Paul works with other IT and cybersecurity service providers on their clients to navigate the complexities of HIPAA law so that they can confidently focus on their business. So let's get started with Paul as he takes us into HIPAA compliance in the midst of the pandemic. Paul, the screen is all yours.
All right, thanks for that introduction, sir. I really appreciate it, Jim. I'm going to go ahead and share my screen, ladies and gentlemen. Bear with me just one moment. All right, there we go. Again, my name is Paul Redding. I am Vice President of long titles at Compliancy Group, but you heard him give that one out. It's Vice President of Partner Engagement and Cybersecurity. What that means is, like he said, I work with IT and security service providers out there to help their clients achieve and maintain HIPAA compliance. If you're not familiar with the Compliancy Group itself, we're something of an industry standard in healthcare. Our seal of compliance, which you see here, has been endorsed by more than 40 major medical associations over our 15-year history. We were founded by HIPAA auditors to help the small and mid-sized businesses in the sector achieve what otherwise looked like an overwhelming task of maintaining their compliance. That seal that you see is what we give out when you complete our process. For example, eTrepid has their seal of compliance. It means that we've put you through a process that proves your good faith under the law at every level, technical, procedural, administrative, all the way across the board to achieve HIPAA compliance. And we're very proud to say that on our entire 15-year history, no client that has ever achieved that seal has ever failed a HIPAA audit. This is is not because bad things haven't happened to good people. They do, including some of our clients, sadly. But because we put you through that process and we issued that seal, we will defend you under audit if you carry it. And we have been 100% successful in proving our clients good faith under the law to achieve compliance. In this sector that we work in, healthcare as a whole, healthcare makes up about 26 to 30% of the US economy. That is before COVID. So again, prior to COVID, healthcare was already almost 30% of the economy. The reason that healthcare has been such a focus for Compliancy Group, for the IT security community as a whole, is healthcare is a very vulnerable sector of our economy. Other than, let's say, manufacturing and finance, healthcare being one of the largest sectors, it differentiates itself from these other groups. For example, manufacturing is basically 4 or 5 really, really massive companies, think like Boeing, right, that trickle down a little revenue to the people downstream. Healthcare is upside down in its pyramid. It's 5, almost now 6 million small to mid-sized businesses that are, not as sophisticated in their IT organization as, say, the Boeing and the top of the chain in the finance sector. In fact, healthcare has a 94% failure rate under HIPAA audit. And over the last several years, increased enforcement, like the actual fines issued, it's up over 400%. That's because healthcare is under attack from bad actors, is what we in the security community call them, because they know you're not Boeing, you're not Lockheed, you're not, Morgan Stanley. You don't have the same protections in most cases in your industry, and the hackers go out to get you. In fact, healthcare is seeing more than a 5 times increase in ransomware attacks just this year, and will increase even more in 2021. And back to why the hackers are going after healthcare so heavily, over half of the hospital administrators, and I mean, think about it, this is kind of the top of the stack in healthcare, right? Over half of hospital IT administrators will admit they don't feel prepared or adequately trained to fight all these new cyber risks. They don't understand them. Most of healthcare IT and the people running the organizations were not brought in specifically for security, right? And as everybody out there in the healthcare community knows, you got weird tech, right? You've got a lot of things that either can't be upgraded immediately or cost prohibitive to upgrade, medical equipment, those kind of things that make for a really nice target if I'm a hacker. Now, recently, the stakes are getting higher, folks. Matter of fact, during the COVID crisis, a hospital on the West Coast had to turn away ambulances all day long because of a ransomware attack. Very sadly, people died. Now what's happening is the hackers are not only affecting your wallets, but they're affecting everyone's lives and our livelihoods as a whole. And by the way, guys, if you're not a covered entity, meaning a doctor, an insurance company, the people actually doing the medical treatment, it doesn't get you out of this bucket. If you work in healthcare at all, you have one single client that you can conceivably in any way interact with their EPHI, you're what's called a business associate, and you're in healthcare too, and yes, the hackers are targeting you. Organizations like, let's say, Target didn't get hacked because Target had bad IT. As a matter of fact, Target got hacked through their HVAC vendor. So everybody in the healthcare community is under the same gun, both from the bad actors and from the fines that follow it. And unlike a lot of sectors in healthcare, the really bad news is if you screw it up, everybody knows. Guys, this is called the Wall of Shame. If you're not familiar with it, you can simply Google HIPAA Wall of Shame. This is that list of good folks that bad things happen to. It's a comprehensive, searchable database of every organization that has ever had a fine or a breach. If your name goes on there, you can't ever come off. And in 2020, in the midst of this whole pandemic, everybody thinks that they're kind of easing up on enforcement. This has actually been a record year for enforcement. We've seen both more fines and more money in fines in 2020 than we've ever seen in our past, and it's only going to increase next year. One of the reasons being, I think it stands to reason, folks, healthcare is going to have money. If you paid attention during this whole crisis, sadly, the hospitality industry, restaurants, all the retail sector has been decimated. Healthcare is continuing to grow. The federal government just dumped out trillions and trillions of dollars in bailout, and they need that money back. Like any organization, they've got to be able to take in to survive. Regulatory law and taxes are the only way the government has of making money. They're going to continue to come after this sector over and over and over again. Now, I know that sounds like a lot of gloom and doom. I'm going to tell you in the beginning, before we go through this whole thing, HIPAA was not done to you to punish you for going into medicine, okay? It's not all damage. It's not all punishment. This whole thing wasn't designed to strictly be punitive. As a matter of fact, what HIPAA, the law actually wants you to do is improve your business and in an ongoing way, make sure that you keep your risk down. It says, hey, start every year with a risk assessment. You have to look at your organization from the top down, not just the IT, but administratively, the whole thing. We'll talk about all the audits that go into this, but you're basically looking at ways that you can be hurt and addressing and fixing these vulnerabilities, right? It's a good thing for any organization to do, regardless of your industry. The same thing is true for the second requirement, which is all those policies and procedures, the employee training that your folks have to take every year. Understand an organization that tells their employees what their job actually is in a clear way have a lot better odds that their employees actually do those jobs, right? If you didn't tell me, how can you hold me responsible for it? That's what the law requires, is that you document what you're supposed to do as an organization and tell your employees what their job is. This builds that culture of compliance that you hear people talk about, a security and privacy first focus from everyone in your organization, from the CEO or the doctor owning the practice, all the way down to whoever's checking you in at the front desk. Everyone there has the same culture of compliance and security, and it shows. We see it from outside. Me as a patient, me as a potential client, I see an organization that is compliant and secure as somebody that I want to work with. Why? Because I know they've got lower risk than other people. Their corporate culture is well defined. It makes me want to stick around. And study after study has shown compliant practices are actually more profitable, largely because of patient loyalty. When people do things right, you want to work with them. Okay? Now, 2020 was a little bit crazy for everybody. I think we can all agree. If you asked me at the beginning of the year what I would be doing, I would say I was probably going to fly 46 weeks this year. All that changed in March. And for healthcare providers around March and August, some other stuff changed and it confused everybody in the market. As something of the industry standard for simplified compliance, at Compliancy Group, our phones rang off the hook for the first couple of months with people asking questions like, hey, I just saw the president on TV say that HIPAA has been suspended. Wait, do I have to have BAs with anybody or it's a free-for-all now, right? All these questions came in, and it's because, sadly, the way that the law works, there's not a great communication method between the lawyers that pass these things and you as the people that are subject to it. You're kind of supposed to do your own research. That's in many ways where we come from, is taking that away from you, okay? So I'm going to try to answer some of these questions today, clear all this mud up, and talk about what it really takes to be compliant, both as a, call it an in-office organization, and then now what everybody's calling a hybrid workforce. Some of you are in the office, some of you are at home, and you trade out sometimes, okay? The first thing that happened, honestly, when the healthcare crisis started and the president gets on TV and says, we're making HIPAA easier during this crisis, we're waiving BAA requirements for telehealth. Everybody only heard we're waiving BAA requirements, right? So you run out and you do whatever you want to. No, guys, check it out. First of all, the first two things they changed really have almost no IT or security bearing at all. The first two major changes were to allow you to operate across state lines more easily and waive Medicare beneficiary cost sharing. I can barely even say that, right? It has nothing to do with the way your organization's actually structured. The last one is tricky. The last change they made in, I think this was late March, was they did indeed say, for right now, we are going to waive the BAA requirements for telehealth platforms. You can use any non-public facing telehealth platform. They don't have to sign anything. And then they doubled down on this kind of semi-suspension of BAAs. Later in August, they said now third-party organizations, we call them those business associates, can now share PHI data for disclosure of COVID data, okay? Previously, they couldn't share it at all. You give it to a BAA, you as the covered entity, hand it over, for example, to eTrepid to back it up. The only option eTrepid has with that data is to give it back to you who sent it to them, right? All of a sudden we had third-party, private organizations popping up doing a whole bunch of COVID testing, and they needed to legally be allowed to share that data for contact tracing. That is all that has changed, guys. The ability to use a specific telehealth platform has been kind of lightened, and a bunch of stuff about COVID sharing that probably does not affect you at all. What does affect you is how you treat your patients, your responsibilities to them, both from a privacy perspective and a security perspective, right? So at Compliancy Group, that phone conversation we keep having is, so I can use any telehealth platform now, right? Well, okay, can and good, or can and should are two completely different things, okay? You can choose almost any non-public facing telehealth platform. So, I mean, you can use Apple's FaceTime right now, for example. It's not public. You can use a bunch of different platforms that would never sign your business associate agreement. But should you? Understand there is a massive difference between the free version of Zoom, they won't sign the BAA, and the paid version of Zoom where they will. It's not just about the vendor wanting more money from you. It's about what the vendor has to do to protect the session. If you guys remember, there was a mental health professional in San Francisco using a free telehealth platform, and that session was actually ended up on YouTube. All of his patient, everything he said was published and posted on YouTube, obviously without permission, right? Why? Because he didn't sign a BAA with the telehealth platform because they can't. They don't encrypt anything. They don't have any of the security measures in place. Apple is not going to validate their system for use for ePHI because there's hoops they have to jump through. In technical terms, HIPAA is very vague. It doesn't come out and call out must have antivirus, right? They call it endpoint protection. They don't talk about Active Directory and all that weird techie stuff. They talk about access control. But these rules are the same for everybody, right? Whether you are a doctor, you're a business associate, or you're that telehealth platform, you're supposed to have what we call technical safeguards in place, including end-to-end, where the data sits and the way that the data is sent, encryption. If you have that in place, your session is protected. If you don't, you run the risk of all this data getting out there. So while the federal government may not right now fine you for that breach because you didn't have the business associate agreement on file, if I'm your patient, that is still my medical data. That is still my mental health session or whatever that is out there on the web. I'll never work with you again. I will blame you, and rightly so. Now, also understand, all those technical controls are still not what makes that version of Zoom compliant. What it means is that the organization, Zoom, has at an organizational level both implemented the technical controls and the correct administrative controls. That's how your business works, guys. So policies, procedures, training, employee attestations, people call it the soft side of HIPAA, okay? The soft side hits really hard if you don't take care of that. So the difference in a telehealth platform that will sign your business associate agreement, let's say the paid version of Zoom, Microsoft Teams is a fabulous one. There's a lot of other very, call it purpose-built telehealth platforms. And the difference in them and like FaceTime is Apple didn't train any of their employees on your privacy. They didn't talk to them about what happens with medical records. They're not worried about destroying the data in the end, and they're not worried about end-to-end encryption to protect you as a covered entity. Zoom, Microsoft Teams, when they hand out that business associate agreement, they're telling you, if you do your part, we're doing our part. So all you got to do is pay for the paid version of Zoom and you're HIPAA compliant, right? Telehealth is good to go. Again, there's always a catch, folks. I said, if you do your part, understand, no vendor, Zoom, eTrepid, anybody, no vendor's compliance actually extends to you as their customer. eTrepid is HIPAA compliant. That means they have their policies and procedures, their administrative places in order. They've done all of their audits and they have all of the technical safeguards in place. That means you can work with them. It does not in turn make you HIPAA compliant. You're responsible for your own. And remember, guys, the patient gave the data to you first. If you're a covered entity, it all began with you. What happens to that data? It's 100% your responsibility. And if it gets screwed up, it's your name that goes on the wall of shame. Now, if you do it right, that seal of compliance goes on your website, right? And you stand out. You look like somebody I want to work with. Because remember, at a 94% failure rate, it stands to reason that 9 out of 10 organizations are not doing the right thing. If you can demonstrate to me that you're one of the few that is, it tells me I want to work with you, right? I need this, and you have what I've got. Now, we're talking about this whole, compliance in the face of COVID thing. And we talked about the fact that business associate agreements are still in place. That's not all that changed. Remember back in the days before COVID, when everybody showed up to the office every day, you were behind a firewall, everything that happened in these closed doors of your office, and all your people were trained, right? Well, all that went out the window when you sent them home. The entire environment changed. The way that the law works, HIPAA is tied to your environment, let's say your infrastructure and your business and the way that you operate. So if you didn't tell your employees and you didn't have policies and procedures and audits set up for work from home and you just sent them home, then you are by definition non-compliant. See, your environment there at the house is completely different than that at the office. And I'm here to tell you, I'm not about to advocate that everybody puts a $2,000 firewall at all of their employee environments, right? But you still are responsible for making sure that the basic HIPAA safeguards are in place or those people can't work. There's a number of ways to do it. But if you break it down, just like your office at work, the home office has what? You've got like an edge, you know, your network layer, let's call it the router or the wireless box. That's stuff you buy from Best Buy, which again, ain't a firewall. We all know it. Then you have the workstation or the endpoint that you work from. In many cases, that's now the employees. It's not the desktop that they had at the office. You had to allow them to use something that they themselves own, right? And then you have how all this EPHI gets from them to a safe place to be processed. Usually that's your EHR. So where it starts, whether it's at your home office or anywhere else, where it really begins is with an IT risk assessment, okay? And again, you do this at your office every year, but when you sent everybody to the house, all that went away and it doesn't count for them. So you've got to go out there, find out what the risks are for your employees, how can they be hacked, how can they lose EPHI data, and correct that so that they're safe. Now, again, I'm also not going to advocate that eTrepid has to send somebody to your house and the mask and the boot covers like the Comcast guy, right? It does not require someone on site to assess this risk. As a matter of fact, we provide our clients like eTrepid a full risk analysis for remote users. It asks the questions that need to be answered of your people, and eTrepid can help them correct things if they're not right. For example, that thing you bought at Best Buy. No, it's not a firewall. We'll get to how you work around that in a moment, but you still can't leave admin as the password to this thing. I can't like Google what the make and model is and know your password to it. You've got to change that at a basic level. Printing, when it was fine at your office before, is a very slippery slope at home. If they're printing, did you send them shredder boxes? Are they using them? Have you talked to them about waste management at their house and the fact that this EPHI data cannot be left laying around in any place? We recommend, as a matter of fact, if you can avoid printing at home, do it at all costs, right? And then about those computers. Look, I can show you an eTrepid can secure a device that an employee owns, and that's doable. But the employee can't have an administrative user for them, an administrative user for their kid to play Fortnite. You can't allow multiple people in the house to use this piece of equipment that you're using for EPHI just at random, right? That you've got to be able to secure access control. Who did what? So we recommend, when at all possible, having a dedicated device for that employee and telling everybody else in the house, things have changed, you can't use dad's laptop, right? The VPN. Now, guys, I'm not going to turn this into two things. I promise I won't turn it into a, full 30-minute prezzo on the legal aspects of HIPAA. And I'm also not going to turn it into an IT presentation where I try to explain how everything works. What I will tell you is that a VPN is a utility. It can be put on any computer. It can be installed on that employee's, personal device. eTrepid will take care of this for you, and it takes you back to that office. It's a tunnel, point A to point B. Now, your employee connects to the VPN, and all the work that they do happens behind that firewall that you paid for at the office. So all that network layer of security, we're not saying that you can get away with it, just use the thing from Best Buy, but log on to your VPN to work by policy. For my employees at my old organization, you're not clocked in if you're not on the VPN, okay? Now, basic protections. You also have to make sure your employees at least have antivirus working, not the little message that says, your Norton has been expired for 396 days, like my mom's computer, okay? But workable, functional antivirus, something to make sure that nobody's in there keylogging them and watching what they're doing. Now, this last part, I want to pause on for a second. privacy in the home. Privacy in the home is different than at the office. I don't know about you, but at my house, I hardly have it. I got a 3-year-old and a 7-year-old that run around the house, and they own this place. It's not me. I'm just paying the rent, right? So these kids are not used to having to respect my privacy to the extent that they would if I'm coming home doing telehealth sessions. I'll pick on my neighbor behind me. My neighbor behind my house works in some kind of finance and sits out on his back porch every afternoon and talks very loudly about all the deals he's doing. Man, if that's my medical record, or even if that was my financial information, I would really appreciate it if that guy would go inside and not share it with whoever's cutting the grass next door, right? But you don't tend to think about that stuff in your house. It stands to reason in your office that it's all controlled, but as soon as you go home, the little meme where you see the couple working side by side in their screens, and this is the new normal, it's not if you're in healthcare, folks. One of you's got to be somewhere else. You cannot be sitting there accidentally sharing this information with everybody. And that's what you're supposed to train your employees on. Remember, what you trained them on last year is how to operate at your office, how to prevent being phished, how to recognize privacy violations, right? All that stuff is good and critically important, but now they're at the house. Who's talked to them about that? The law requires that every year your employees are trained on their work environment and the policies that affect them. So if you don't have a teleworker policy in place, for example, and you don't have procedures of telling them what to do and train them on it, then they can't work from home. It's a violation of the law. I had the undersecretary of the CISO, or the CISO for the Undersecretary of Defense. I met this woman, Katie Arrington. She describes a policy you're not following as a list of stuff she should fine you for. And that's what the law says, okay? Now, I promised we are not going to turn this into a massive HIPAA lesson. The law is like 1,000 pages long. It was written by lawyers to be interpreted by other lawyers and audited by even another set of lawyers, okay? But what I can tell you is, like any regulatory act, it all breaks down into rules. HIPAA is 3 major rules, and associated with each rule is a series of audits to make sure you're complying with that rule. So most people, why the failure rate is so high, why 94% of organizations flunk their audit, is because they think that by achieving compliance with the security rule, they've become HIPAA compliant. What does that mean? Well, I need to be HIPAA compliant, so I called eTrepid, right? They came in, they put in my security stuff, they did my IT risk assessment, right? They did my meaningful use audit, all of that stuff, I'm compliant. Well, yes, you're compliant with 1/3 of the rule. You're compliant with exactly 1/3 of the security rule. Even within the security rule, there's another audit for physical audit, and yet again, there's an administrative and privacy audit completely separate to any of the IT stuff. It's how your physical business is set up, the way that you have to shut doors when you talk to patients, okay? Then there's the privacy rule. It has its own set of audits. And this one over here on the right, the green one, this is the omnibus rule. Most people associate it exclusively with MIPS. I'll tell you what omnibus means to me, and you'll never forget this. I call omnibus the on the bus rule. It's what brings all the other businesses into this thing, okay? The on the bus rule says, if you are eTrepid's client and you're on this HIPAA bus, they got to get on the bus with you too. Everyone involved in EPHI management is on the HIPAA bus. It's where the business associate agreement management comes in. So again, if all you do is put in the technical safeguards, look at your IT provider and go, I use the paid version of Zoom, I got a firewall and all my IT stuff taken care of, I am HIPAA compliant. I'm here to tell you, you are going to be bit everywhere else here if you are ever audited. And the reality is the policies, the procedures, the access control rules, and the employee training around it are what they're going to look at first in an audit, okay? They are going to look at the IT portion as it relates to your policies and procedures, not vice versa. Now, there's a reason for this, okay? I'm talking about hackers, and I tell you that they fine you for the policies and procedures. Don't think that they're just shooting in the dark, right? The reason is because the reality is the tech didn't fail most of the time there was a breach. The tools that eTrepid is going to put in for you work really, really well. They're not throwing any virus at stuff anymore. I mean, we're talking advanced stuff, EDR, MDR, SOC SIM, a bunch of acronyms that you don't understand. These tools are better than they used to be. They do a good job. The problem is most of the time, human beings screwed up. Somebody in an organization failed to follow a policy or procedure, and they caused the breach. They caused the attack. They caused the violation. And worse, I hate to break it to you, but many times the people that did this are untrained IT folks. There's a difference between an organization like eTrepid and that kid down the street that runs around fixing broken computers. He doesn't have policies and procedures. He doesn't have administrative functions behind him to make sure that he's checking his work and doing everything correctly. And those breaches, that's what causes the audits, and that's what causes the fine. I liken it to the, vampire in the movies, right? I can put garlic on all the windows and crosses on all the doors, but if I invite the vampire over for dinner, I'm going to be dessert. There's nothing I can do once he's in my house. That's the way this stuff works. So they're fining you because the policies and procedures are what's wrong. Like this guy. I hate to pick on this guy, but I don't know if anybody out there knows who he is, but I bet you remember this. A few years back in Hawaii, everybody's phone went off, all your alarms at once. Said North Korea was sending nukes to Hawaii. Major panic, right? Everybody freaks out. It's all over international news. The Hawaii Emergency Management Association put out a false report. Well, no, they got hacked. And the reason they got hacked is partially because this guy right here was so proud of his new job. He took a picture for Facebook, he posted it, he wanted everybody to know he was one of the IT directors at the Emergency Management Association, but that association did not have policies and procedures in place, and they had not done their risk assessment, or they would have told him he can't stick his password to the system on the computer screen. But he did. Right there for everybody to see, and he posted it on Facebook. It doesn't take long for me to exploit that, and I don't have to be a hacker. Guys, anybody in the room, if I give you my username and password and tell you what system it is, can get in there and take it over. It's a failure on the administrative and privacy pieces, not the technology, that resulted in first a major catastrophe and presumably this dude right here losing his job, okay? When I came into the industry, let's back up and date myself, I'll say almost 15 years ago. HIPAA was at a different position then, right? The risk assessments were being encouraged, but there weren't a ton of fines being issued. And when I would go out and I would talk to doctors and medical folks and talk to them about my IT security and HIPAA, and I'd say, what are you doing for your HIPAA right now? I got this answer all the time. I'm doing HIPAA Lite. HIPAA Lite, what does that mean? And what that means when people say they're doing HIPAA Lite, it basically means I called my IT guy and I told him, fix everything that's not HIPAA compliant from an IT perspective. Like, tell me what it is and fix it. So I know everybody for MIPS and meaningful use, you've done one of those IT risk assessments, right? Tells you what's wrong. IT team fixes it, and then maybe you download some templated policies and procedures off the internet. Something that you can stick in a binder and say, no, that's my HIPAA stuff over there. Guys, that is not HIPAA. There is no such thing as HIPAA Lite at all. That's like saying I got antivirus and my entire environment is secure. If you're working with eTrepid, I don't think anyone out there believes that Norton is enough to make you safe, right? There's no HIPAA Lite. HIPAA Lite is a great way to fail an audit. HIPAA Lite contributes massively to that 94% failure rate because people don't want to understand. And because people look at the big picture, they look over there on the right and they go, I don't want to do all that. What does that mean? There's like all these audits and gaps to identify, and I can't handle it. This is where we were born. This is where we come from. This is why organizations like eTrepid work for us, right? Or work with us, because we're going to pick up everything that goes beyond the IT portion. You're working with a provider that is going to come in and take care literally of the real risk associated with your IT. They're backing up everything. They're end-to-end encrypting it all. They've got monitoring and logging and auditing and all these things put into place to secure that side. But ultimately, it's your responsibility to pick up the rest of this stuff, and that's why they bring us to you. That's where we come from. What we did for eTrepid and is what we would do for you. Compliancy Group comes in and makes all this complexity go away. We have brought compliance down to 3 things. We call it AIM. You achieve, illustrate, and maintain your HIPAA compliance. The achieving is the part where we work with eTrepid. They're going to do all the risk assessments related to IT, the device audit. They're going to look at all your systems and do all your scans. But we are going to give you a compliance coach, assign you into our system, and put you through the other audits. There's an audit called a high-tech Subtitle D privacy audit. If you don't know how you did on your high-tech Subtitle D privacy audit this year, we need to come help you do this, because you've got to do it every single year or you're out of compliance with the law. Now, just like the IT portion, when we do those audits, we're going to find gaps. In the high-tech Subtitle D privacy audit, many of the gaps that we're going to find are about policies and procedures you don't have in place, about administrative functions that you haven't documented. But that's okay, guys. You don't then get sent back to try to find your own lawyer to deal with it. We're going to do that too. As a matter of fact, for every question that's asked in any of those audits, we have a built-out policy and procedure that will customize for your business, that will make sure it applies for you, and it actually reflects what you're doing, and it checks off all the boxes in those audits. So picture a giant field of all red, it turns it all green through a combination of the IT stuff that they're going to put in at eTrepid and all the policies and procedures and administrative aspects that we're going to help you enforce in your organization. Now, all those policies and procedures are no good if your employees don't know what they are. In HIPAA terms, training is not the video that tells you how not to get phished every month in email, right? Training is not a video about changing your password. What they mean by training is have your employees read a version of your policies and procedures that they can understand. Have they attested that they did indeed understand it and that they will follow it under penalty of law? And have they done that both when they got hired and on an ongoing annual basis as a part of maintaining their job? That's going to be tracked inside our system, because that's where the policies and procedures are built out. So all of your employees are going to have to go into my system and attest legally to exactly what I just said. It's proving that this took place. Saying that my employee just attended some training session or sat in on this webinar today does not qualify as your HIPAA compliance, okay? The next thing we're going to do is that business associate management piece. This can be a real quagmire, okay? Which of your vendors is a business associate and which are not? Obviously, eTrepid, doing all your backups, working with us, they're very happy to sign this business associate agreement. But what about your shredding company? What about the other, let's say the medical billing group you work with, call centers? What about your phone provider? Do you have business associate agreements in place with those folks? And if you only had 10 days to provide them, can you show them all right now? That's another function of what Compliancy Group is going to do for you. That's part of the illustration piece, okay? So first we've gone in and we've done your audits, and then we've built out your policies and procedures. That's achieving. Now, business associate agreements. We pulled them in and I can prove it. And lastly, incident management. I told you in the beginning, bad things happen to good people. One of these days, those good people could be you. What is a trouble ticket or a minor breach can be something that really sends you down a path with HIPAA that you don't know how to navigate. If you are ever required under audit or investigation to provide response, instead of you digging out that giant book and flipping through paperwork and trying to stuff it all together, you respond with, we work with Compliancy Group, please accept response from them, and we're going to give out all of your work. We're going to be able to show everything that we've talked about today in a clean, concise report written by an auditor designed to deliver exactly what auditors want to see. And that's why nobody's ever failed an audit working with us, because we know what they're looking for. Our system is designed to be able to illustrate and prove it. And as a part of maintenance, we're reviewing it on an annual basis. We're coming back in and touching that organization and making sure that your culture of compliance is still strong. All of your employees know and are following their jobs. All the policies reflect the current law. And by doing so, we're protecting your reputation and building out that culture of compliance. See how simple it is, guys? The reality is I can boil a 1,000-page law down into a couple of hours with a coach and a bunch of policies and procedures that we're going to help go in and implement. You're going to let eTrepid handle all of the IT nerd stuff that we don't understand, and we're going to handle all the legal nerd stuff that you don't understand. Together, we'll give you a complete compliance program. Now, I told you in the beginning, the world has changed this year. And leaving today, if I'll give you anything to take with you, look at the way that your organization was in 2019 and what you're doing today. Understand this is the new normal. I know that thing gets tossed around a lot. It's never, ever, ever going to go back to exactly the way it was in 2019. No vaccine, no mask wearing, nothing is ever going to take us back and say, okay, the entire world is going back into just an office environment. This whole telehealth thing was a fad. All that stuff's going away. I think we all realize that telehealth jumped forward 5 years nearly overnight in March. It's not going to swing back. If you weren't doing this last year and you didn't have all this stuff defined, it's time to stop, assess your risk, and define what this looks like for you. What is your organization going to be doing in 2021, and how are you going to comply with the law? And then do a risk assessment. You need to call eTrepid and get them to help you look at these remote worker environments and make sure that they're both safe. It would be critically bad if you get hacked because you sent somebody home, but that they're also compliant. Have they attested to follow the rules? Do they know what the rules even are? Do they have policies addressing the way that they operate? And if they don't, you've got to get those policies and procedures in place. At the end of this, you'll actually be able to reach out to eTrepid. Through them, we can extend to you our bring your own device policy. This is a policy that allows employees to use equipment that they actually own. And we have a teleworker audit. These are the questions that you need to ask your employees and get them to say, yes, I've changed that password. Yes, I have antivirus. All those things that we talked about. And you got to document that somewhere, because again, if you ever have an audit, you are going to have 10 days total to prepare your entire response. So if the policies and procedures are not right, you're not going to make it up in 10 days, folks. You're going to have that stuff in place now. I'll bring it back with one analogy. HIPAA compliance, all of the stuff that we're talking about is like Algebra 2, which I hate to admit was the only class I flunked in high school the first time I took it. I did not fail because my answers were wrong. I failed because I couldn't show my work. And I would turn in a page full of right answers, and my teacher would beat the crap out of me with a red ink pen because my work was wrong. That is what HIPAA compliance is. It's like Algebra 2. You can't just turn in the answers and expect to pass. You've got to be able to show all your work. That is what we do for organizations like yours, organizations like eTrepid, some of the largest EHRs in the world. We do this for people every day, day in and day out. We can show your work and prove your compliance. Now, another document that we'll give you is this right here. I recommend that everyone reach out and get this from eTrepid. This is your HIPAA compliance checklist. Everything that I've talked about today is right here. If you go down this and you can mark every single one of these correctly, then you're good. Don't worry about it. If you get audited, you're good to go. But I'll tell you again, the very first question I'll ask you right now, how did you do on your high-tech Subtitle D privacy audit this year? If you feel like I did the first time I got that question asked, you need to call eTrepid at the end of this, and we should set up a call because we can help you take care of that. And that's what I've got for you today, guys. I know we're going to have some questions here at the end. So I'm going to kind of hand it back over to Jim and make sure that any of your questions get answered. Thanks so much for your time and attention.
Paul, thank you so much for the presentation. Very, very good presentation today. A lot of good information. I'd also like to just say, so Paul's mentioned that eTrepid does have the HIPAA seal of compliance. We worked with Compliancy Group because we really want to protect our clients, and we feel it's critical that that they maintain that HIPAA compliance and security. Compliancy Group really made it easy. It simplified our own processes and really took the burden off, just as Paul had said, and just allowed us to focus on delivering customer service to our clients, and they took care of all the policies for HIPAA. The other thing that is important is, we're developing a culture of compliance internally throughout the company. So it was very important to demonstrate the compliancy and security core values inside of our organization. And really last is the seal. We want to show off our compliance. The seal really sets us apart from other companies out there, and we really think it's a great partnership with Compliancy Group to maintain the HIPAA compliance for the businesses that we support. So Paul, thanks again. I know we do have some Q&A, so I want to go ahead and introduce Mahar. If you have any questions, please use the Q&A to ask your questions. But Mahar is in there. Mahar, can you go over any of the questions that we have at this point?
Yep. Hi, everyone. So it does look like we have a question. So we have moved to Office 365, which works as our backup. Is this sufficient for disaster recovery?
Paul, you're on mute there.
Oh, sorry. I think eTrepid would probably have the same answer I do here. Jim, so Office 365, I'll ask you, what is the backup situation with 365? Just because it's there, is it backed up?
Absolutely not. So there's, eTrepid does have a secondary solution. So Office 365 doesn't back up, so it wouldn't meet HIPAA compliance. But eTrepid does have a solution that actually backs up Office 365 as well as SharePoint and the other solutions that are out there. So it's, and I think you'd agree with me if you want to elaborate from your information.
Yeah, absolutely. The first time I heard this, I was dumbfounded. I mean, I was a service provider, right? So the first time I had somebody pull this, they said, Office 365 doesn't back anything up. I was like, wait a minute, what do you mean? It's highly available, right? It's on servers all over the world. Yes, your copy of that data is spread on servers all over the world. And if one of those servers crashes, you're still going to have that data, but you only have one copy of it. So say, for example, there's a new ransomware out there that attacks cloud nodes. You're done. You have highly available access to nothing at all. And if you go read Microsoft's user license agreement and their business associate agreement, both of them actually call out and tell you this data is not backed up. It's your responsibility to back it up. And believe this or not, the first time I saw it, my jaw dropped. Microsoft actually recommends the use of a third-party application to back that data up. So does Google, by the way. It's not unique to Microsoft. These cloud platforms are not inherently backed up. People have this huge misconception around that. But to your point, without proper backups in place for 365, no, it's not HIPAA compliant.
Right. That was a good question.
Yeah, that's one I've seen that one before. And the same thing, guys, I would say this as well, just because I'll take one more leap here. Just because you use a clouded EHR doesn't mean you're HIPAA compliant either. And it doesn't alleviate the responsibility of that local workstation having all those access controls and protections in place. If you can screenshot or you can print locally or you can pull it down, it's your responsibility to protect the flag. There's nothing you can do to hand that over to your EHR company.
Right.
So it looks like there are no more questions, so we can continue on with the presentation.
Okay, great. Well, thank you all for joining today for this HIPAA compliance webinar. This is the end of our coffee and conversation series for 2020. We'll be taking a brief break in December, but don't worry, we'll be gearing up for more great topics in 2021. Be sure to keep an eye out for the release of our 2021 conversation schedule, and if there's a particular topic you would like to hear about, let us know by filling out the survey at the end of this event. Survey is also a great way to provide suggestions so we can ensure that you get what you expect to see and hear when taking time out of your day and to join us for these webinars. Again, if interested in discussing more about HIPAA compliance, we'd love to talk to you. So please feel free to contact me using the information on the screen. For additional questions, we've also provided Paul's information at the top corner as well. Our team will also be sure to follow up with everyone regarding the $10 Starbucks gift card for coffee today. In the meantime, you feel free to follow us on social media if you're interested in getting updates on industry information. Check us out on eTrepid on Facebook, Twitter, LinkedIn, Instagram, and YouTube. Thank you all for joining us. We look forward to hopefully talking to you soon and seeing you at our next Coffee and Conversations in 2021. Have a great week and please stay safe.
Hey, thanks so much, Jim. I really appreciate the invitation. Y'all have a great day.
All right, Paul. Thank you so much.